I'm Debbie Stokes of Three Women Voices. Diabetes is a disease that looks for opportunities. And if you give it a chance, it will come knocking at your door. According to the American Diabetes Association, over 30 million children and adults in the US have diabetes. That's 1 in 11 people. And 84.1 million adults are pre diabetic. Today, my special guest is Gwendolyn Woody. She is a nurse and a certified diabetes wellness coach. She is also a nutrition coach. She will be talking to you about your health and what you need to know about diabetes. Hi, Gwendolyn.
Hi,
How are
thank you for the
you?
introduction. That was nice.
Thank you. Thank you. I'm happy to have you here.
I'm happy to be here. Thank you very
Yes.
much.
Okay, so tell everybody a little bit about yourself and how you got into diabetes wellness.
My family have had a very, very bad time with diabetes. When I started this, I had 17 family members succumb to diabetes and its comorbidities. So when my mom was diagnosed as a pre-diabetic, I said, we have to do something about this because I didn't want to lose my mom like my other family members had succumbed to the disease. So I started studying and telling her about the things that she can do. She dropped her hemoglobin A1C, in which she is now not a pre-diabetic any longer, thank God. So my whole mission and passion is to help people live. And so many of us um, are afflicted with diabetes. And as you said in your intro, it is an opportunistic disease. It doesn't have to be, but it highly works in communities that don't have food markets and people that don't know about nutrition, and in families that feel like, oh, it's okay because Aunt Susie or Uncle Johnny had it, so I'm supposed to have it. But you don't have to have it.
Tell everybody what diabetes is.
So diabetes is a disease that basically your body makes insulin, right? So sometimes our pancreas doesn't want to work well, or our insulin cells become a little sluggish. So we develop diabetes. So the insulin does not work on the glucose, which is the sugar, to make it be used for energy, throughout our body.
Mhm.
So what happens is that extra glucose floats around in our veins and our vessels, and slowly but surely, it will cause damage. I think that's the easiest way I can explain it.
Okay, okay. And are there different types of diabetes?
There are several different types of diabetes. You have diabetes type 1, which used to be known as juvenile diabetes, but this is a diabetes that usually you are born with. Or for older adults, you could have what's called late onset diabetes, which is also diabetes type 1. And in this disease, your pancreas is not working at all. Those insulin cells are not working at all. So you are relying on insulin from other sources. More than likely, you have an insulin pump. In older adults that obtain this disease, usually it's because a virus has attacked their body and destroyed the cells. Then we have prediabetes. Prediabetes is a precursor to being a type 2 diabetic, and your glucose is not high enough to be called a diabetic, but it's the opportunity for you to reset yourself so you won't be a diabetic. Type 2 diabetes is basically the population diabetes, if you will, because now we have not only older people, but more younger people. We have children because of latent activity that also have diabetes type 2. Then we have diabetes related to steroids, We have diabetes related to other diseases too. I do believe in all there are clinically about 11 types of diabetes.
Really?
And yes, and that also includes gestational diabetes. Most moms get the glucose tolerance test. I want to say around 6 or 7 months. It's been a while since I had a child. So around that time, the doctor does a fasting blood glucose to see what their hemoglobin A1C is. And most patients that have gestational diabetes usually wind up being a type 2 diabetic. So when they
Mm.
find out they have gestational diabetes, it's very, very, very important for them to change their lifestyle to try to beat it before it gets them.
Okay, okay. So what are the symptoms of diabetes? What are some
So symptoms, sorry. The symptoms of diabetes or the signs, you may have blurred vision. You may have a rash on your skin. You may have frequent thirst. You may also have frequent urination. You may, for women, develop frequent urinary tract infections or frequent yeast infections, depending on your glucose. You won't be able to heal as fast. It'll be slow for you to heal. You may also notice that you sleep a little bit more, like you really feel tired or lack of energy. You may feel jittery at times. Another thing is that you may feel confusion. Another thing also, our limbs. Um, you may notice that they may feel numb or tingling. These things are not normal. And even though any one of those signs and symptoms can go to another disease, but when you start looking at the whole picture, you'll notice that it is diabetes, especially the frequent urination and feeling thirsty, because your body is trying to replace the fluid, and the fluid is trying to push the extra glucose out.
Okay, okay. Is it ever fatal?
Diabetes can be fatal.
Okay.
Another type of diabetes is usually, it can happen with a type 1 diabetic. It can happen with any diabetic, really,
Okay.
is when your glucose becomes over 600, over 400, over 500, you can go into diabetic acidosis, ketoacidosis. And this is a critical emergency where you do have to be hospitalized. The doctors do have to give you an insulin drip and other measures to get your body to come down, to get your glucose to come down. You
Mhm.
can also have a diabetic coma. A diabetic coma can occur at hypoglycemia or hyperglycemia. So if you have a blood glucose that, I would say I've seen it in people with blood glucose lower than 60. The guidelines is 70 and below. But if you have a low blood glucose, and I mean low, you most definitely will exhibit signs of a diabetic coma.
Okay.
Yeah, and above you can as well. I've seen it more in hypoglycemic people than I have in hyperglycemic.
Okay. Okay. Does having diabetes introduce you to other ailments or diseases? You know.
Most definitely.
Okay.
Having diabetes, the glucose that remains in our veins and our vessels can be very torturous. It can be very dangerous, not only to our heart, our lungs, our kidneys, but to every body system that we have. So even with cholesterol technically, textbook, it's sugar, right? But this sugar builds up into this fat, which is a lipid. So that's why they call it cholesterol. And then it builds like these little clots, if you will.
Mhm.
So it can occlude your vein and your vessels, right? And that could put you at risk for a stroke. Um, Diabetes can also cause you um, to have problems with memory, um, vision. So you could have diabetic retinopathy. Could also have arterial sclerosis, our lower extremities, our legs, they can become dark and sort of heavy, and that's because of poor blood circulation, because our veins and vessels are filled with this glucose that is occluding good, healthy, strong blood to get down there. And of course, our body's automatic response is heart. Whatever we need to do to keep the heart beating and pumping, we're going to do. So if it means to shut down in other areas, we will. Diabetes is also related to heart attacks and kidney disease.
Okay. So what are some things that people can do to maybe lower their risks of getting diabetes? Or if they have it, to lower the numbers. And then what are the numbers that people can?
So to lower the risk of diabetes, we want to be proactive. I know a lot of people, they don't want to make the change, right? Because they're fearful of friends, family. Oh, I won't be able to do this. I won't be able to do that. But creating a healthier lifestyle will make a big, 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 big difference. And I'm not saying that you have to do everything at one time. I say try one thing for 3 weeks and you have it, right? And then you try something else. So then you have 2 lifestyle changes, right? So lifestyle changes, nutrition is key, activity is key. I know that we're in COVID-19 season right now, but you can still walk up and down the stairs in your house for 30 minutes. You can still walk around your block or your neighbor, right? You can do jumping jacks. If you have a bicycle, you can cycle. If you have a treadmill, you can get on a treadmill. You can do plenty of things. You don't have to necessarily sit on social media all day. You don't have to sit at a video game all day or your laptop. You can make yourself active. It's your choice. And with nutrition, we have to look at what we are eating. We really do. Some of the things that people eat are not beneficial to them. And again, in our communities, and I'm saying Black communities, we have, it's healthcare disparity, really, because we don't have, most of our communities don't have good food markets. And if we do have good food markets, the prices of the things that we need are outlandish. Like the produce may be 5 or 6 times higher than if you go to another neighborhood and buy your produce. Then again, I want to stress mindset. You have this diagnosis, but this diagnosis does not have to have you. Diabetes also is a very expensive disease. The last time I checked, $88.9 billion. Right? So think about how much money you have to take out of your pocket every month, not only to pay your insurance, but to pay your copay, but to buy medications and special things that you may need, right? It can be, don't even think if you got sick, it's even more money. So the numbers, so we would want to have in a good range a hemoglobin A1C that is under 5.5. It would be better if it was like between 4 and 5. We want to have a fasting glucose that is 130 or under. After we eat, a random glucose should be under 180. The key is our height, our weight, our body mass index, and also our abdominal circumference, the girth. These things make a big difference. No one is textbook. So like I'm 5'3". A gentleman that is 6'4", of course, his numbers are going to be different. The thing of it is that you have to know your numbers, you have to keep track of your numbers, and you have to know what your normal healthy is.
Okay.
So what my normal healthy is may not be textbook normal healthy, and it may not be the gentleman that is 6'4" normal healthy.
Okay. Okay. So now, is there a difference with diabetes in men versus women?
The thing with men is that, and I just wrote a little class on this,
Okay.
men could have retro ejaculation
Mhm.
because of diabetes. Men may have lower testosterone levels because of diabetes. So, and some of the diabetic medications. So, they can also, if their sugar levels, their glucose levels are completely out of range, and I
Mhm.
mean high, they consistently high, they can also develop a gangrene,
Okay.
necrotic wound, if you will, behind their testicles.
Mhm.
I don't know why it always lands there. I've seen it textbook and I've seen it in person in clinic.
Okay.
So this is dangerous because anything that has gangrene or necrotic, that's dead tissue, and you have
Yes.
to do surgery to get rid of that. So that's where it really affects men. With women, again, the UTI infections and
Mhm.
yeast infections, an
Oh.
increase of yeast infections. Um, so you really have to, and it's no way of saying, oh, I'm not, that the person is not cleaning themselves, yada, yada, yada. You on top of your blood glucose. There's no ifs, ands, or buts about it. Um, especially men. Now, the difference between men and women are what I just stated, but since I've sort of relaunched some things, I've noticed that most of the people that are interested are women between 25 and say 50,
Mhm.
and surprisingly, young men between the ages of 20 and 30.
Mhm.
Men that are a little bit older and a little bit more set in their ways are not apt to be proactive until something happens,
Oh, okay.
which is sad
Mhm.
because you can work so hard and then all of a sudden, we see it time and time again. So the difference I would say is being open and willing to learn what to do,
Okay.
right? And for our community, sometimes that can be hard.
Mhm.
Now, in the difference between races, diabetes prevalent in the poor white communities. They're not going to tell you that, but it is.
Okay.
Diabetes affects them the same way. I will be honest and say that doctors will prescribe different medications depending on your ethnicity.
Oh.
As a nurse, I've seen this. And when I used to be an ophthalmic technician, I saw this. So there's always a difference of medication, a difference of treatments, and other things that could actually help you or harm you. So
Mhm.
you have to be like really wise in this, or really smart, or wanting to know. You have to ask more questions. Um, I will tell you that Black women and Native American Indian women
Mhm.
rank, and then Hispanic women rank high on the level for diabetes in America.
Okay.
Um, White women and white men are a little bit down, but it is still prevalent in their community. I would say
Okay.
it hits more older adults. I find Caucasians may be hit with type 1 diabetes, which is the diabetes that you are born with.
Okay. Okay. So now, how often should a person have their blood sugar checked?
And by their physician,
Okay.
or just by their physician, every visit that they go, if they are truly a diabetic, the hemoglobin A1C should be every 3 months. If you are diabetic or a pre-diabetic, you should be checking your glucose before breakfast, before lunch, before dinner, before you go to bed. And if you're taking a long-acting insulin, you most definitely want to check it before you give yourself that and make sure you're eating.
Okay. Are there different ways that you can check your insulin besides pricking? Are there other methods?
So, really, the only other thing we have is a continuous glucose monitor that you can apply to your abdomen, you can apply to your arm, any part of your body. And that's still a small needle, right?
Mhm.
Um, Other than that, it's not, we can test it through urine, but the most accurate is through the prick, the blood.
Is that painful?
It can be. It
Okay.
depends. So the needles most definitely and the lancets most definitely have gotten finer and smaller. The places that you can stick yourself or prick yourself are more abundant because before, it's just the finger, but now you can check on your arm, fatty areas of your body. So it's more opportunity. Um, that you can use now instead of just your fingers.
Okay. So now when you're taking medication for diabetes, what are some most common medications? And then what are some side effects of medications?
Wow, I just did a class on metformin.
Oh, okay.
But this is funny. So, okay, I'll go over that because that is one that is highly, highly prescribed. Metformin is also known as glucophage. Glucophage is a biguanide, which is an oral insulin, and the purpose of it is to lower your blood glucose. It has its pros and cons. A lot of people don't like to take it because they don't know how to take it. Their doctors don't explain this to them. So, metformin can cause you to feel nauseous. It can cause um, impotence by medication. It can also increase the good cholesterol. It can lower the bad cholesterol. Um, it can cause you to have a modest weight loss, but it should not be used as a weight loss medication. Um, Metformin can cause you to um, have flatulence or gas, and vomiting as well. So, with all of those things, there's only 2 or 3 good things about it. The rest of it, nobody wants to take a medication that they have to take an hour before they eat, right? Because a lot of people don't live on a set schedule, right?
Mm-hmm.
So it becomes a little bothersome. And it can come in a round pill, oblong pill, or liquid. Some people don't like to take pills, and the liquid is not a good taste. So
Okay.
that's one medication that they prescribe heavily to people that are pre-diabetic and diabetic. Um, and they can prescribe it up to 1,000 milligrams twice a day. That's a
Okay.
lot, which can also cause hypoglycemia if you don't eat.
Okay. Okay. Now, is there ever a time when a diabetic is feeling good and they should stop taking their medicine?
So if you are playing Russian roulette, don't
Yes.
do it.
Okay. Yes.
Don't do it. Don't do it. So anytime that you should stop taking your medication is when you're working with someone such as myself, a registered dietitian or physician, and you're watching your diet, you're getting your activity, you have 5 to 7% weight loss, your glucose is coming down, your hemoglobin A1C is in the 5 range and not the 6 range,
Mhm.
right? So people that just take their medicine whenever, you're going to fail yourself because it's going to sneak up on you and attack you.
Okay. Does being a diabetic mean that you have to watch what you eat?
Yes, you do have to watch what you eat.
Mm-hmm.
You just can't um, eat to eat. I say eat to live, eat to thrive. Um, and you want nutrient dense foods. You want fiber. You want um, vitamins, right? You want foods that are going to help your body fight anything. So you can, through diet, reverse pre-diabetes. You can put type 2 diabetes in remission.
Okay.
Yes.
Okay, because I've heard people say that I've lost weight and I've been exercising, and now I don't have to take medicine anymore.
So if they have went through the whole process and
Yes.
had their hemoglobin A1C and everything like that done, then yeah, then more than likely that is absolutely correct.
Mm-hmm.
Hmm.
How important is exercise when you have diabetes?
It's very important. Just like the disease that I talked about, the arterial and the arteriosclerosis, when you have lack of circulation because of the extra glucose in your veins and your vessels, what happens is that those limbs start to die because they're not getting fed nutrient-rich blood. What are they getting? Nothing. No oxygen, no nutrients, nothing. So they shrivel up. What will happen is that you may notice that they will become black, necrotic. You may notice gangrene. What happens? You see a vascular doctor and you may have to have surgery.
Mm,
And this surgery is to remove a digit, which would be a finger or toe,
mm,
or a limb, which could be an arm, a foot, or a leg.
mm. Okay, that's good information. How bad is overweight or being overweight to diabetes?
So this is a hard question because some people are overweight and healthy,
Okay.
right? And then some people are overweight and not healthy. Now we know that scientifically people can be just predisposed to being overweight, but then we also know some people eat their way to being overweight.
Mm-hmm.
And I would say that is more so the people that eat themselves to being overweight than the people predisposed to being overweight.
Got you.
So it depends on your lifestyle, because you have a positive attitude, you are eating the right foods, you are exercising, you may not have it, you may not develop it.
Right.
But on the other hand, if it's like, oh, I'm just going to eat McDonald's, Burger King, yada 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 all day. I'm gonna have that steak, that mayonnaise and butter mixed together that some people do with the crab sauce thing. You're killing yourself. I
Mm,
hate to say it, but you're killing yourself. And I think people don't really want to hear that their habit, could take them out,
mm-hmm.
literally take them out.
Mm-hmm. Because I'm one. I had bad eating habits, and
Oh,
yes,
oh wow.
I'm working on it. Right
Yeah.
now, I don't have diabetes yet, though.
Yes.
So I'm trying to, fix that. Yeah.
Hmm.
Okay. So is diabetes hereditary?
So this is my thing. My mom had told me a long time ago that, oh, well, I have a big stomach and heart disease, yada, yada, yada runs in our family. I rebuke it in the name of Jesus. So there now, what can I say? If you have a strong family history of diabetes and you're not taking care of yourself, yes, you will be automatically considered like a pre-diabetic.
Mm-hmm.
But that does not mean that you are going to develop diabetes. Diabetes, in my opinion, is a socioeconomic opportunistic disease.
Okay.
By that, I mean, if you are in a society that does not care about their health and well-being,
Mm-hmm.
boom, more than likely you will develop those socioeconomic diseases.
Okay.
If you are in a society that promotes health and wellness, more than likely you will be healthy, right? And well. So I dare not say that diabetes type 2 is hereditary. It can be relatable, but I don't want to say that it's hereditary. Now, diabetes type 1, you are born with. So
Okay.
there's a big, 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 big difference.
Okay. Okay.
Mhm.
So now, what are some signs of a diabetic attack that you're going into having an attack, and then
So,
people around you know or do to help you?
okay. So I don't want to say that is an attack almost. So it would be like the diabetic coma that I
Okay.
talked about, the hypoglycemia, where you feel shaky, jittery, you just can't get a hold of yourself. And if you actually do go into a diabetic coma and pass out, it's your responsibility before that incident that you made your family, your friends, your loved ones, your coworkers well aware that you are a diabetic, that you may have to eat more frequently, and that, let someone know who your emergency contact is, the whole kit and caboodle. Yep.
Okay. Okay. I remember having an aunt, and I would be doing her hair, and she would sometimes, I guess, get fidgety and things like that, and she would have me run to the store to get a piece of candy or something.
Hmm.
How effective is that?
I'm sorry.
How effective is like giving somebody a piece of candy when they're going into an attack?
So as a diabetic, they will also want to have on them either glucose tablets, a piece of candy, a banana, some milk. Those things can raise your blood glucose. So if a person is becoming hypoglycemic, again, they will feel jittery. They can recognize the signs and symptoms. They may be diaphoretic, break out in sweat. They know. They
Mm.
know. They don't just go out, but they will, like your aunt did, know and ask for something. So it can be effective.
What kind of effect does stress have on diabetes?
Stress, it causes a lot, not just diabetes, but everything. So that's an external thing. And some people don't realize that you can have internal diseases with no known reason. Like you're completely healthy, but all of a sudden you have a heart attack. But it was because of an outside stressor. I actually had to explain that to a patient a couple of weeks ago. So you want to stay as stressless as possible. Um, you know, that's part of the reason why I moved to Texas
Okay.
because I wanted to be in the sun. Um, I need that more every day than just getting it, certain times of the year,
Yeah.
right? So you have to do what you have to do for your well-being. And if that means telling people no or changing your path of life, do what enables you.
Hmm.
Do what creates your healthy. Do what makes you happy. So especially women, because women wear so many hats.
Yeah.
Um, you can only do you. You can't take on the world. You can't save everybody. And it's okay for you to say no, right?
Hmm.
So when you say yes to yourself and you see the difference and you feel at peace and you see, blood pressure, glucose numbers, cholesterol, all that stuff go down, you'll see a big difference.
Okay. So now, what are some things as a nurse that you see people doing that concerns you? For instance, like not taking their medication that diabetics do.
So the thing that really concerns me is that people that need help,
Hmm.
they won't get the help.
Oh.
Um, they, for whatever reason, don't see the seriousness of it. I understand not being ready. I do, because it's a mind thing. You have to accept it. But don't wait. So, like I told you, the 17 people in my family that died from diabetes and its comorbidities. So, think about how many generations that is. Not getting help is not helping you, it's harming you. Now, there are a lot of people out here that are building legacy for their family. But if you have this thing called diabetes, right, are you still going to be able to build legacy? You're not, right? Diabetes will take over if you don't control it.
Okay. So now, getting to the coronavirus. Talk about some dangers as it relates to diabetes and other underlying issues.
So COVID-19, the coronavirus, number one, it has been around for a very, very, very long time. This is not a new virus. It is part of a series of viruses. Coronavirus does hit people that are immunocompromised, people that, number one, have heart disease, number two, have diabetes, and number three, have respiratory issues, right? You're immunocompromised. Your body is not strong enough. Your immune system is not strong enough to fight this illness. Can your body fight it? Yes, it can fight it. But you have to nourish your body in a certain way, clean guts, right? And nutrition. And you have to actually get natural sunlight, vitamin D. You have to walk. You want to do some deep breathing, expand your lungs. So it has taken out people that have been immunocompromised more than those that have not been. But the more healthy, active, the more you nourish yourself, deep breathing exercises, getting sunlight, keep your gut clean, you should be well with your immune system.
Okay. Now, what I found out and I didn't know was surprising to me is that they considered a person with high blood pressure to be vulnerable to the corona.
Yeah,
I didn't,
because high blood pressure is technically a heart disease.
okay.
So anybody that has, so it's heart disease first, then we have diabetes, and then we have respiratory disease.
Okay. So healthy people need to take social distancing seriously.
Healthy, yes. There's a difference between social distancing and quarantine, right? And there's a difference in isolation. So do we want to practice social distancing if we are healthy? Yes. We most definitely want to practice social distancing if we are healthy. Point blank, period, right? That would be, arm span, 6 feet apart.
Okay.
In any given situation or any given area. Quarantine is when you have signs or symptoms of the coronavirus. So what would that be? You may have a runny nose. You may have a cough. And I'm not just talking about an allergy cough, but you may really have like a really bad cough.
Okay.
You feel a heaviness on your chest. You feel shortness of breath. You can't get up, right? Like you are feeling extremely weak. You may also not be able to smell or taste food.
Oh.
Okay. So they just pointed that out the other day. So these are the things that would cause you to quarantine yourself.
Okay.
Now, if you go to the ER with any of those symptoms and they check you out, they'll tell you, go home and self-quarantine for 14 days, right? Then, if you're in the hospital, you are going to go into isolation if you are admitted, because most of these patients are put on the ICU units, intensive care units, because the shortness of breath now has become a closed airway, a collapsed lung, bleeding from your nose, bleeding from your
Mm.
mouth, coughing up blood, right?
Okay.
You can't breathe anymore, so you're intubated either through your nose or they're doing a tracheostomy through your throat, right?
Okay.
So you are very critical.
Okay.
So social distancing can help prevent the other thing.
Mm-hmm.
And what we want to be aware of are signs and symptoms. We want to be aware of the places that we go, the people that we come in contact with.
Mm-hmm.
No, everybody does not have gloves. No, everybody does not have a face mask, but you can still be proactive in your measures without gloves and without a mask. And
Mm-hmm.
if I can add this real quick, the
Mm-hmm.
thing with gloves, right?
Mm-hmm.
Gloves are one-time use. So when you use them, throw them away. You
Mm-hmm.
see people that have gloves and they go from place to place to place to place and they have not changed their gloves. What they do not realize is that they are spreading germs and they are spreading disease,
Mm-hmm.
bacteria, virus, whatever they touch, right? So within that, even me as a nurse, I don't wear the same gloves with the same patient. You know what I'm
Okay.
saying? So
Yeah.
in
Yeah.
that room, if I'm in there for 10, 15 minutes, I may have changed my gloves
Yeah.
2 or 3 times,
Okay.
depending on what I'm doing, right? So when you're out in the community and you're wearing one set of gloves, you're doing damage and you're increasing
Mm-hmm.
somebody else's susceptibility to a virus because you don't
Mm-hmm.
know what you touched, right? And we can't see it. The mask. The mask that is needed is the N95 mask. If your immunity is low, yes, you should wear a mask. If you are a healthcare worker and you constantly are working with patients, screening patients, yes, wear a mask. There are the N95 mask, a dust mask, and we also have a surgical mask. The N95 mask is the mask of choice,
Okay.
right?
Mm-hmm.
But as we see now, there are not enough to go around. Isn't that funny? Secondly, the dust mask. I'm sorry, the dust mask, where construction workers may
Yes.
wear these, right? You can wear those because they will act as an N95 because they have the carbon filter, right?
Okay.
Next, we have the surgical mask. So with the surgical mask, which is usually made out of this paper like material
Mm-hmm.
and goes over the bridge of your nose, around your ear. Once that is moist, you have to throw it in the trash. It is no longer working,
Okay.
right? If you are making the mask, you
Mm-hmm.
need to order the carbon filter. On the back of the mask, it should be um, a little pocket where the person can put the carbon filter and
Okay.
just, you know what I'm saying? Now,
Mm-hmm.
with the N95 mask, it's not a one size fit all. You have to be fit for the N95 mask.
Okay.
Um, if you get one, just make sure it's fitting around your nose and around your ears
Okay.
because you don't want anything to get in,
Gotcha.
right?
Okay.
So that's my little spiel on that.
So I want to I want to thank you for doing what you're doing as a nurse, and all the nurses and all the frontline people that have to deal with people who are sick. So what would be your plea to people about making it easier for you as a nurse? You know, like so that you can come home and be with your family and you won't get sick and things like that.
My plea is that people actually take this seriously. The plea would be for people to be conscious, you know, don't take it as a joke. Don't think because you don't know or have seen anyone that doesn't have it that it's not real. And I mean, pay attention to everything that is wrapped around this virus. Um, Pay attention to the news reports, pay attention to the science, pay attention to the trials for a vaccine. Wash your hands. If you use hand sanitizer, 3 times then wash, right? Hand sanitizer is not a cure-all. Washing hands with that friction is. And also, if you continuously use the hand sanitizer, you may burn off accidentally the epidermis layer of your skin, which would leave you open for infection. Also, go to the website, the CDC, the World Health Organization. Those people will give you accurate information, right? You can't go wrong with them because that's where I get my information from. I don't just make anything up.
Okay.
Now, the other thing is that if you are in a situation that you're not sure what to do, call a hotline. Plenty of hospitals now have hotlines set up where you can ask questions. Plenty of places also have testing sites and screening sites.
Okay.
Everyone more than likely will not be tested, and that's sad because they don't have enough testing kits.
Yeah.
But you can be screened and you can monitor yourself.
Okay.
So monitoring yourself and watching, signs and symptoms is probably the best thing you can do. Improve your nutrition during this period. Don't consume heavy, lofty meals. You want foods that are actually going to encourage your immune system. Drink more water during this period. Keep your gut clean. But do practice social distancing. Do wash your hands. Keep your environments clean. And don't be sedentary during this period. Get up and move. You can't go far away, but even where I live at, you can still go walking. You can still go to the park. You just can't be close to someone,
Yeah, gotcha.
right?
Okay.
So those are key things.
Okay, so some last words of advice. Do you have any that's about diabetes or health in general that you can give?
My advice is that if you are seeking help for health and wellness and you know you're needed, but you're scared, give it a try, right? Don't be unhealthy because you're not sure. So it took you all this time to find the diagnosis or get the diagnosis, but you don't have to live that way for the rest of your life, right? So get some help, look for resources, and get you healthy. Like stay healthy and stay happy.
Okay, okay. That's good information. Thank you so much.
Thank you.
They wanted to reach out to you. How can they reach you?
So the best way to reach out to me now on social media is Facebook, Instagram, LinkedIn, either Gwendolyn Woody or the Nutritionist and the Nurse. My email is post at the nutritionist and the nurse.com. But the backup email is the nutritionist and nurse at gmail.com. I do have a website, but it's about to be revamped, so I don't want people to visit it and it go off. But I post sort of frequently on my Facebook and on my Instagram. I did on LinkedIn today.
Okay. Thank you, Gwendolyn.
Thank you.
It's been a pleasure. And I want to say, if anybody wanted to reach out to Three Women Voices, you can reach us at threewomenvoices@gmail.com. Our website is threewomenvoices.com. We're on Instagram at 3_women voices. And Facebook is 3 Women Voices. And I thank you for watching.